An amazing day for Amy Roberts.
It's fantastic. It was everything that I've ever hoped and dreamed for. I've wanted to get married at the Hotel Hershey since I was a little girl, so it was a dream come true.
Just to see her so happy and healthy and in such a good place and looking forward to the start of her marriage and hopefully starting a family someday, it's just a really exciting time for us as a family to watch it.
An exciting time for Amy and Dan now and for years to come.
We would love to be parents one day, not something that we're actively pursuing, but we've talked about it and it's definitely what we want to happen down the road.
Amy wasn't sure a family was even a possibility.
I started having various symptoms when I was around 16. It ranged in everything from really debilitating cramps, upset stomach, things like that, and we thought for the longest time that it was actually a digestive issue.
I was home for a break from school and just noticed her laying around a lot and seemed kind of sad and not herself, and I just thought that that was kind of odd for Amy because she's always so upbeat and happy and just ready to go.
Amy dealt with stomach cramps for a couple of years until it became too much.
It would have been my senior year of high school, the fall. One day I woke up and I couldn't get out of bed. I was in so much pain I couldn't stand up straight, and we went to the ER right after that. Spent the whole day in the ER at Hershey. At the end of that day, the ER doctor came in. Oddly enough, I had a kidney stone at that time as well, but he had said, based off your other symptoms and the timing and everything, he was like, you may have something called endometriosis.
So endometriosis is when the glands, the endometrial glands that a woman has when she would have her period, that part that sheds out is called the endometrium. Those glands, instead of being on the inside and shedding out when you have your period, they implant on the outside, implant in places in the pelvis or in the abdomen, places outside of the uterus. And those glands then will grow and cause inflammation, pain each month, just like as a woman's having her period.
Spring of my senior year of high school was when I had my first surgery, and he was able to confirm that I did have endometriosis, and that kind of started our game plan of how to kind of suppress the symptoms and make sure I could have a good quality of life.
The role of surgery can be multifold. It helps to confirm the diagnosis, and then it can also infer treatment. If you can remove the endometriosis, you can hopefully give them times and periods of relief.
He was able to prescribe me medication like birth control, other various hormone suppressing medications to try and help lessen those symptoms.
Amy did have some relief, but a couple of years later, the symptoms returned.
I remember reaching out to Dr. Harkins and saying, the medication's not working. I didn't want to have to rely on pain medication to, get me through my day. And he said, I think based off of everything, it's time to go ahead and schedule a second surgery.
Surgery was scheduled on Christmas Eve when Amy was home on break from college.
I was still awake when I rolled into the OR, and I remember just kind of laying there and looking around, and it was terrifying seeing everything around you. And I remember Dr. Harkins walking in, and he's singing Lady Gaga, and I knew I was gonna, be okay, because that was who was gonna handle my surgery, and he's making me feel comfortable by dancing around the OR singing Lady Gaga, so I knew I was gonna be okay. Sorry.
And I try to always remember for every patient, this is a huge moment. They are concerned that something's going to come up, that they're not going to have fertility, they're not going to have good function in their life. They're young women. It's important every day that we take care of patients that we remember that. So I'm glad that was reassuring or positive for her, because we try, we try to keep things positive.
I remember Amy was just kind of bedridden at that point because she had just had surgery and she was kind of missing out on all of the fun stuff you get to do with families over the holiday. And that's when it really clicked with me how serious this diagnosis is, and that she was willing to kind of throw away her Christmas vacation to recover from a surgery because she was in so much pain, and it gave her the relief that she needed.
I was symptom-free for months. Felt like a normal person again.
Several years later, Amy was back at Penn State Health for surgery.
They had just gotten the Da Vinci, the robotic surgery system there, and that was actually the first time I had gotten surgery with that.
We do use it for endometriosis cases. A lot of endometriosis excision is about precision and trying to remove active disease while maintaining normal anatomy.
So it's been almost 6 years now since I've had one, which is the longest I've gone between surgeries, and I've been like a whole new person since that time.
Amy's done great to have all this time to do so well, and that's fantastic. That's what we want.
Amy can't thank Dr. Harkins enough for all he has done for her now and in the future.
He truly cares about your life and what you want, and it's nice knowing someone that will preserve that for you and take your thoughts into consideration about your own health. I was able to have a pain-free wedding day, which was wonderful.